Good day everyone, my name is Gigilan Velasco from Sasn, Quezon City. So now I'm going to do an oropharyngeal and nasalpharyngeal suctioning. The definition. Suctioning via oropharyngeal, mouth and nasopharyngeal or nasal route is performed to remove accumulated saliva, pulmonary secretion, blood vomitus, and other foreign material from these areas that cannot be removed by the patient's spontaneous cough or other less invasive procedures. So the equipments that we are required are Yankauer catheter, sterile water, tubing attaching suction canister to wall source, suction machine, lubricant, the gloves, and tip catheter. The procedure is perform hand hygiene to prevent spread of infection. Ensures privacy to maintain privacy. Introduce yourself and explain the procedure and purpose to the patient and identify the patient. Providing information fosters the client cooperation and allay his or her anxiety. Hi ma'am, my name is Gigilan Velasco from Sasn, Quezon City. So I'm your student caregiver for today. So ma'am, can I check your wristband? And state your name and when is your birthday?
My name is Geraldine Velasco.
And when is your birthday?
March 17, 1972.
Okay, thank you. So ma'am, I'm performing oropharyngeal suctioning. Is that okay with you?
Okay lang.
Dioximeter to monitor of his or her oxygen saturation level. Okay. Help the patient into semi-fowler position to or setting position. Okay. Assess for signs of the patient may require suctioning such as gargling, drooling, gastric secretion, vomiting, unrelieved coughing, drape her neck and chest. Put the gloves and use a mask and gown and face shield. If splashing is likely, fill a cup on basin with about 10 ml sterile water or sterile saline. Connect one end of the tubing to the suction machine and turn on the suction. So this is the sterile water. And the tubing. So let's assume that we put the connecting tubing here. Okay. Then connect the other end the tubing to the Yankauer catheter. Verify that the suction mechanism is working properly by suctioning a small amount of sterile saline from the basin. So, let's assume that this is a catheter. If the patient has no oxygen mask, remove it or keep it near her place. If she has a nasal cannula, leave it to place. Now insert the catheter into the patient's mouth, moving along the gum line toward the pharynx. Apply suction and move the catheter around the mouth with all the secretion have been clear. If the patient has no oxygen mask, replace it. Now suction water or normal saline through the catheter until the connecting tubing has been cleared of secretion. When the suction With the suction, turn off, wash the patient's face. So, turn off the suction machine. And wash her face. Assess respiratory status and repeat the suction procedure if necessary. Then remove the drape or towel and place into the trash or laundry if it's soiled. If she has a diminished level of consciousness, help the patient into the same position to encourage drainage. Store the catheter in a clean, dry place. Help the patient into a comfortable position and perform mouth care. Reassess respiratory status and oxygen saturation for improvement. Call for help if any abnormal signs and symptoms appeared. The rationale of this identifies positive response to suctioning procedure and provides objective measure of effectiveness. Ensure patient is in a comfortable position and call bell is within reach. Provide oral hygiene if required to promote patient comfort. Clean up supplies, remove gloves, and wash hands. Document procedure according to hospital policy. The respiratory disease cleanup prevents the transmission of microorganisms. Documentation provides accurate details of response to suctioning and clear communication among the healthcare team. That's all. Thank you. So now I'm performing nasalpharyngeal suctioning. Before performing nasal tracheal suctioning, make sure the patient has no contraindication to the procedure, such as bleeding disorder, epiglottitis or laryngospasm. Perform hand hygiene to prevent spread of infection. Ensure privacy to maintain privacy. Introduce yourself and explain the purpose and procedure to the patient and identify the patient, providing fosters the client's cooperation and allay his or her anxiety. So ma'am, I'm Gigi Velasco from Sasn, Quezon City, and I'm your student caregiver for today. So ma'am, can I state your name and when is your birthday?
Geraldine Velasco. March 17, 1972.
Okay, thank you ma'am. So now I'm performing Nasalpharyngeal suctioning. So is that okay with you ma'am?
Okay.
Okay, thank you. So now apply a pulse oximeter to monitor of his or her oxygen saturation level. So this is the pulse oximeter. Help the patient into semi-polar position or sitting position. Prepare your equipment by connecting one end of the tubing to the suction machine. So, this is our connecting tube.
We put here.
Turn the suction device on and set the pressure to the lowest level possible that will effectively clear secretion. After checking the pressure by blocking the end of the tubing, place the open-ended tube near the patient with an easy reach of your work area. Now prepare the suction catheter by opening the suction kit or catheter using a septic technique. So let's assume that this is a suction kit. And this is a lubricant soluble solution. If a drape is available, place it across the patient's chest or on the overbed table. Fill the tray compartment with about 100 ml of sterile normal saline solution or sterile water. So let's assume that this is a sterile water. So we put it here on the compartment. Open the water-soluble lubricant and squeeze on the open sterile catheter package. So let's assume that this is a lubricant. Be careful not to touch the package depending on your agency's policy. You'll now apply either a pair of sterile glove or a sterile glove on your dominant hand.
So this is our dominant hand.
A clean gloves on your non-dominant hand. So this is our non-dominant hand. Use your dominant hand to pick up the suction catheter without touching any non-sterile surface. So let's assume that this is our catheter, suction catheter. Touch the catheter to the tubing to make sure the equipment works properly. Suction a small amount in a normal saline from the basin. Increase the patient's prescribed oxygen flow rate, instructing her to breathe slowly and deeply. Light coat 6 to 8 cm or 2.4 inches to 3.2 inches of the distal end of the catheter with the water-soluble lubricant. Miss Geraldine, I'm gonna go ahead and suction down your nose into your lungs to help get out some of those secretions.
Okay.
Okay, thank you. Your non-dominant hand to remove the oxygen delivery device. Ask the patient to inhale deeply. Use your dominant thumb and forefinger to insert the catheter gently but quickly into one of her nares as she inhales. So let's assume that we insert the catheter into her nose. As you insert the catheter, do not cover the catheter vent. Follow the natural course of the nares. Orient the catheter downwards slightly. Don't force it. If you feel resistance, you probably hit the carina. In the case, withdraw the catheter 1.2 cm between 0.4 and 0.8 inches before applying suction. When you're performing nasalpharyngeal suctioning, a good general rule is to insert the catheter to roughly the same depth as a distance from the mouth or tip of the nose to the angle of the mandible. In adult is about 16 cm to 6.4 inches. In older children, 8 to 10 cm, 3 to 5 inches. An infant and young children, 4 to 7.5 cm to 1.6 to 3 inches. If you're performing nasal tracheal suctioning, insert the catheter about 20 cm to 8 inches on adult. Older children, 16 to 20 cm and 6 to 8 inches. To infant and younger children, 8 to 14 cm to 3 to 5.5 inches. In some instances, turning the patient head can help you suction more effectively. Turning it to the right will help you reach the left main stem bronchias, and turning it to the left will help you reach the right main stem bronchias. Apply intermittent or continuous suction by placing your non-dominant thumb over the vent of the catheter over 15 seconds or less. At the same time, slowly withdraw the catheter as you roll it back and forth between your dominant thumb and forefinger. Then encourage the patient to cough. Replace the oxygen device and instruct her to inhale deeply. After it, repeat the suctioning procedure, but don't perform more than passes. Watch for the alteration in the patient cardiopulmonary status. When possible, allow adequate time, at least 1 minute between suction passes, to allow for ventilation and oxygenation. Rinse the catheter and connecting tubing by suction normal saline until the catheter and tubing had been cleaned of secretion. Dispose of your supplies in the appropriate receptacle. If indicated, reset the patient oxygen to its original level. Her blood oxygen level should have returned to baseline by now. And remove and dispose of the drape and reposition the patient. Help the patient into comfortable position and provide oral hygiene as needed. Perform hand hygiene. Document the procedure including your pre and post suctioning assessment, the amount, the consistency, the color, and odor of the patient's secretion, the size of the catheter you use, and the patient response to the care.